station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, folks, welcome to Bobo 103.1 FM. And we obviously every single Friday, we have the privilege of doing the Healthcare Today show, all brought to you by HSA, where we talk to the good folks from HSA, males or females, superheroes in their jobs, whether they're talking about a special department, a specialty, or maybe a conference that's coming up. We have the privilege to talk to them first, or maybe there's something you need to learn that's upcoming with the HSA team. We've heard so many things that are happening over there in the hospital. Is breakthrough. That's things that you just don't know about. The experienced team, the new doctors that's being added, the specialty that they're taking on. And I have the pleasure today in talking about a very important topic. Insurance indeed is, but we're also talking about patient identification, registration, and insurance verification in healthcare. I have the pleasure of having John Douglas with me today and Rohan Robinson, who is going to be joining us on the radio today just to talk about what those subject matters mean. But before we jump in, every single time we do the show, we get to know these individuals more and what they do and how long have they been with the organization. So we'll start with Rohan first. John, actually, let's start with you because you were the supervisor here and you've actually been with HSA for a very long time. I feel like I've seen you there forever unless it was somewhere else, right?
Good morning. Morning. I've actually been with HSA for only a few years.
Oh, wow.
But
Where were you before? Because I feel like I've seen you in healthcare.
I worked at the Ritz.
Okay.
I used to run the restaurant 7.
Yeah.
That does breakfast and brunch.
Yeah.
I was there for many years.
Is that where I saw you? Is it Ritz I saw you?
Could very well be.
Yeah. It was perhaps Ritz.
Yes.
Yeah. Well, you know what? Good on you, Ron. You play a very good, a big role in the HSA. So tell us more about you and how you came into the role and how long you've been serving it.
So I joined as a registration officer in 2021 and was given the opportunity to become a business coordinator in February of 2024.
Yeah.
Where you get to see an entirely different aspect of registration out there. I grasped it. I then used what I learned from business coordinator along with my already experience of being a registration officer and applied for supervisor. And I've been in this capacity now for a little over a year.
Oh, wow.
Yeah.
Okay. Congratulations to you, man, John. Well deserved because I know, like I said, I felt like I've seen you there for a while, but it perhaps maybe in the service industry. But obviously you are someone that indeed loves to serve, right?
Indeed. I've leaving the Ritz, I'm coming with 13 years of experience. From there, bring it into HSA.
Yeah.
So customer service is definitely something I'm very passionate about.
Tough job. So what do you like about it the most? Let's not focus on the negative, but let's focus on what you love about it the most.
The thing that I love most about it is knowing that I had a part to play and relieving somebody's burden, relieving somebody's pain, knowing that they don't leave the same way they came, that I have the opportunity to be a part of a greater team, and that the entire experience starts with me.
Yeah.
And if I set the tone correctly, the whole thing is a wonderful experience.
Yeah. And you know, sometimes when somebody is coming in to see you guys, it's their worst day. It's what some of them would say is their worst day. And you guys have to try to figure out, a lot of the times, I wouldn't say try to figure out, but you probably already have training in this and not how to take it personal.
Yes.
And what that person perhaps may be going through that day, right? Because insurance play a very extremely important role because without it, it's expensive.
It is.
Right? The care is expensive. So thank you so much for what you guys do. Now we're going to take it over to Rohan and just kind of know more about what you do, Rohan, in your role and how you got into it, how long you've been serving in that job.
Hello, my name is Rohan Robinson, and I look at myself as a COVID baby because I actually came in at the beginning of COVID.
Oh, wow.
Yeah, so that was in 2020. So I've been at HSA from 2020 until now. So I've always been in registration within HSA, team lead, also during the course of my tenure here in registration. So, overall, I love what I do. As we are talking about service. I'm in the church as well.
Yeah.
And being at HSA, I'm able to bring all aspect of who I am into the service industry within HSA, and it's wonderful because when I go to work, I don't just look at it as I'm going to registration or I'm going to work.
Yeah.
The way I look at it is that I am actually impacting someone's life.
Yeah.
I'm actually able to change someone's, by the time they walk in and see me, I want to make sure that I can impact them whether with a smile, whether with laughter, because as you indicated, it's difficult. Individuals are coming in.
Yeah.
They are hurting. They have different ailments, different things that they are dealing with. And if I'm able to make a difference in their time there, to me, at the end of the day, I can go home and I can say that I did my job.
Yeah.
So it's multifaceted.
It is.
Yeah, it's not just about insurance. It's not just about checking a person in. It's a wholesome experience when you walk into registration. In essence, we can become everything at that moment in time in order to meet the need of that person right there and then. And it's a great responsibility.
It is. It's a wonderful responsibility. And I love what you said just about, like, you love what you do. You both said that. You love what you do. You love the process of your job, serving people, and figuring out things. You coming in during COVID, though, was a tough time because it was the strictest time in healthcare. How was that? We can't skip over that one. How was that?
The person that interviewed me, she asked the question, "Why are you so happy? This is COVID. Why are you so happy?"
Yeah.
But no, I said to her, I appreciate that I filled out the application and you called me. So for you to call me, you saw that there was something that I could bring to the organization. So for me, I was joyful.
Yeah.
I was happy. I don't take it lightly.
Yeah.
So, you calling me saying, "Hey, I want you to be a part of this at this moment, at this time, in this season."
Yeah.
And I said, "Okay, here I am."
Love it. Love it. Mr. Robinson, is this the first time you work in healthcare, or you've done this overseas too?
I have done insurance before. So I understand some aspects of insurance and how vital and critical it is to have it. Because I always look at insurance, or whenever I try to explain insurance to individual, in essence, you cannot just look at what you are paying on a monthly basis as to say I am paying $300 monthly premium on a monthly basis. You can't just look at it from that point of view or perspective. You have to look at it from the perspective of just in case something happened.
Yeah. Yeah.
So you may not use your insurance for an entire year or 2 years. However, you cannot look at it to say, well, I am healthy. Since I haven't used my insurance for an entire year, I could have saved that money.
Yeah.
Because now, once you stop paying for that monthly premium, 2 or 3 days after, something can happen.
Mm-hmm.
And when you need it, you don't have it. So my philosophy is it's best to have it and don't need it than to need it and don't have it.
Well said. Well said. I love that. Love that statement. Now, guys, we're going to get into some things that I think a lot of patients would like to know. And I think this is going to be one of those shows that we're going to have a lot of questions. Obviously, you can send them in because after the interview is done, these guys can still answer it, or it can be sent to the marketing team. Monique will then take it over to the fellas. And if they want to answer anything, they can be sent it over to you. Bobo 103.1 FM is how you find us on social media, Facebook or Instagram. I think the first one we want to touch on is a patient identification and registration. So let's touch on what is a patient identification in healthcare. And anyone can take this question. And it can be both too.
So patient identification is the process of making sure that we have the correct patient information before providing care. This usually includes confirming the patient's full name, date of birth, and medical record number if known. And the reason why it is important to identify yourself is we want to make sure that we are providing the right care to the right individual.
Yeah.
For example, there are 3 persons with my name on the island. Obviously, not all of us have the same birthday.
Yeah.
Many times persons ask if that one of the individuals is my father. When I come to the hospital, I want to make sure that they're not accessing someone else's file.
Yeah.
I may have an allergy that those individuals may not. The doctor looking at someone else's file would give me medication that I'm not supposed to receive, which would be detrimental for myself.
Yeah.
So it's very, very important to identify the correct individual.
And this happens because, I've heard in the States in particular, just one story, and I've heard something here too, where a wife was called because her husband was near death. And because they didn't have the right identification, they found out it wasn't her husband. It was just somebody with his name. So they were called because for that same reason. So this is an important topic. Some people may look at it and be like, okay, yeah, it's a simple process. But yeah, things like this do happen. And what you just mentioned, something important, right medication. Yeah. If you have the same name as somebody out there, so thankful that Dane Ramoon is so hard to find in Cayman. Like, it's not a lot of people with Dane Ramoon name, but imagine that somebody picked up the wrong file. And obviously I was allergic to something that they're going to give me. And yeah, that's a lot. That's a lot. Go ahead. Sorry.
It is indeed. It is indeed. And imagine being on the receiving end of that phone call.
Yeah.
Only to discover later that your spouse is perfectly fine.
Yeah.
The psychological damage that would have.
Yeah.
You know what I mean?
Yeah. Yeah. And it can obviously be very critical. Like the hospital could be sued for that, couldn't they?
Yes.
Yeah. They could be sued for stuff like that. So that you guys are protecting yourself with stuff like this, right? Anything else you want to add on that, Rohan?
And not just, and I definitely protecting ourselves, but at the same time, protecting the patient. And what we want individuals to understand that we care about all aspects. Once you walk through those doors, you are walking in to say that I trust this organization, I trust this facility, and I believe that this organization or facility will take every measure possible to make sure that I am okay.
Yeah.
Because you are coming in for a service, but it's not. But that service entails a wide variety of events.
Yeah.
And everything plays a role of working together. And we don't just want individuals to look at it from one dynamic, but look at the whole entire picture.
Absolutely.
It's about safety. It's about responsibility at the same time.
Absolutely. Well said. Now, the next question I want to ask is, we definitely did answer why is this patient identification is something important. But what I do want to ask is, if I'm coming to HSA, right, one of the things that's always asked from a patient is to confirm their information every visit. That is something, whether you registered before in the past, you've done this many times, and now you have to confirm everything. Why do you guys do that? Why is that done?
It's a very important safety practice. Even if a staff knows the patient. Say, for example, you are my biological brother. I know you, everything about you. It is still important to ask those details. Because if for any reason the hospital needs to get in touch with you, we have the most accurate and up-to-date information on file. persons change their phone number for various reasons.
Mm-hmm.
They move from place to place. Emails get deactivated. You lose access to, patients' information change all the time.
Yeah.
So it's important for us as a healthcare provider to have the most accurate and up-to-date information so that at any given moment we can get in contact with you.
Yeah. Okay. That's really good. And then also like to ask, is anything you want to add to that, or is that she perfectly said that?
When I look at this aspect of it, it may seem overwhelming.
Yeah.
If I was in the on the other side of being a patient, I may find it overwhelming and time consuming, and so on and so forth. So we can be real. We are humans. So
Amen.
We have emotions and feelings. Right?
Absolutely.
But I look at it from this perspective as well. Many of us do travel.
Mm-hmm.
Okay. When you go to the airport, you go to the checkout counter.
Yeah.
Okay. You have to present your ID.
Yeah.
And they do every checks and balance right there.
Mm-hmm.
And then they give you your passport or your license back. Then after that, you have to go through the immigration aspect of it again, right? Before you do check luggage. So they're going to ask you for your ID and the same information that you gave them, right? Okay.
Yeah.
So after you finish that, you're going to now sit down for an hour or so. Then you have to enter onto the flight, right? So they're going to ask you for it. Your ID, and also your passport ID and your boarding pass.
Yeah.
So these are things we do consistently on a daily basis. So it's the same within.
Why do you think it's different for like doing that in the hospital though? Like, wait, because you just brought up a very valuable point away from the conversation of the topic. It's intriguing, right? Because when I go to the airport, I know at least 8 times during this travel, I am going to show my passport. That's 8 different times. I am going to sign a document at least 3 times. Yeah. So what do you think the difference is?
That's a good question.
There's not really a right answer for it.
No, that's, and I think sometimes it is expectation.
Yeah.
And I think sometimes individuals, they, depending on what is occurring or going on in their livelihood, whether they only may have so much time.
Yeah.
Okay. And whether it's work or whether they are just not feeling well. As I said, it's a hospital and individuals not feeling well. Sometimes individuals may not have enough time, traffic in the morning. So I think it's an accumulative of a whole lot. Yeah. Not just one specific point where you can look at to say this is why. But this is what we want individuals to understand, that it is a safety practice. It is a safety measure. Yeah. In essence, when you get onto the HSA or the registration flight, we want to take every precaution necessary to make sure you get to your destination. Yeah. And that is because we care. We are concerned about you, and we are hoping that individuals do realize that we are taking every necessary precaution possible to make sure they are okay. And we don't want to have anyone to come in. I said this to my supervisor, that it's not for us to treat it registration like it's an assembly line, that you just come in, just tap and push and tap and push. No, as we're talking about, there are details we have to capture just in case something happened. Then we will be prepared to answer any question, whether family members or whomsoever may ask. And that's what we want to do, is to be equipped and prepared. So if there's any question that needs to be answered, we have the answer.
Absolutely.
But we need the help and the assistance of those who are coming in.
Yeah. Well said. Well said. I like that. What is the main information that is taken during this registration? Like when you come in, like if I got to come in on different days, or 1 week from now or 2 weeks from now, what is the main information that you guys are checking for?
Your phone number, your street address, your post office box, the KY code, and your email address. Time to time, we may ask you your guarantor and your emergency contacts, depending on the situation.
Yeah. Why is the emergency? We'll jump right into that. And I'll give this one to Rohan. Why is the emergency contact very important?
Well, just as a word, if there is an emergency, And the thing is, we don't ever know when an emergency will happen or when it will occur.
Yeah.
And we want to make sure that that information is updated at all times, because emergency contacts, as John stated, or phone numbers, all of those things change or changes over time.
Yeah.
So therefore, we don't know. We have no knowledge. We can't predict outcomes. However, us having the help and the assistance of those who are coming in, once you are aware of that, then you can say, hey, before we go any further, my emergency contact changed or my phone number changed. So in essence, we are a team.
Yeah.
We are a team, and when the team works together, then everything can be efficient and effective, because again, it's for everyone's all safety.
Yeah. I always laugh about how it'd be as an older guy going to the hospital, because my emergency contact would perhaps change every week if I was having a disagreement with my wife. So it would be somebody else every single time. And I mean that with love. I mean that with love if she's listening right now, because we don't have arguments anymore. We have disagreements. Then we come back to the table and we sort it all out. Guys, we're 20 minutes in, and this has been a wonderful conversation so far. We're going to take a quick commercial break. When we do come back, we'll ask more around everything that has to do, because this is more than just insurance, right? We're talking about patient identification, registration, and insurance verification in healthcare. Don't go anywhere. We'll be right back. Keep it locked.
The Health Services Authority has over 120 world-class physicians offering the most comprehensive range of specialist services on island. Our dedicated team of professionals provide the highest quality care in orthopedics, interventional radiology, women's health, geriatrics, and a host of other specialist areas. We are a JCI accredited organization with a proven record of excellence. At HSA, we are committed to caring for you. For more information, visit hsa.ky.
Welcome back to the show. It is Bobo, 103.1 FM. Dane, it's Dane hanging out with you. I am your host today, and I lost myself for a moment there. But I have some special guests joining us in the studios. We're talking today on the show, patient identification, registration, and insurance verification in, of course, healthcare. Today is Healthcare Today, all brought to you by HSA. If you have any questions, go ahead and send us a message on our Instagram or Facebook at Bobo 103.1 FM. Now, earlier we talked about identification. What is it? What are you doing when you come in? How important is this patient identification? Now we're moving on to what documents should patients bring to register whenever you're registering for patient identification. So we'll make anyone take this question.
So when you come to the hospital to register for any service, you are required to bring a government-issued photo ID, as well as provide your healthcare information. Now, there's not always the option to provide an insurance card, because some of the insurance companies have actually moved away from physical cards and they're now issuing electronic cards. However, you will be asked to provide both of these things at every registration process. The reason why we ask you for a government photoed ID is because we want an official document issued by an official office to which officially identifies you as an individual. Persons bring cards that have their picture, maybe have their workplace, that doesn't have their date of birth on it. That is not an official ID. Your driver's license, your passport, or your voter's card, or even the new national identification card that's being issued.
Yeah.
Those are official sources of identification. Once you hand that to the officer, you are going to be asked to confirm your name and date of birth, even though they have it right there on the card in front of them. The reason being is because that is, again, another security measure we have in place to make sure that you are who you say you are. You know your credentials, and you are being given access to the correct person's medical information.
Yeah. We go in a lot, and thanks for answering that too, by the way, John. But we go in a lot, and sometimes we think that just bringing a basic ID is enough. But why is it important? I want to kind of stretch it out a little bit more, that you have the birth date on their different IDs, and you need to know that it's official. Why do you need to know that?
Because persons try, believe it or not, to access other individuals' medical information. I can know your name. I can know your date of birth. I can know where you live. But the chances of me having an ID
from me
with all of your information, with my face, is next to none.
Yeah.
To get that from an official government office.
Yeah.
So that is why it's important to provide us with that information.
Yeah.
So that we make absolutely sure that Dane Ramoon standing in front of us is Dane Ramoon on that ID.
Yeah. Every single thing too, because you're talking about height, eye color, everything is on this.
Everything
ID.
is on there.
Yeah,
everything
so it's
there.
very important. That's true. I like that. I'm glad I asked that question, because a lot of people sometimes would like to say, well, why can't you just use this? I'm showing you that I am who I am.
Yes.
Doesn't matter if my birth date or anything else is on it, the height, brown, what color my eyes is. But yeah, that's an excellent point.
Because it's a safety issue as well, because your personal medical information should not be shared with anyone else. There's data breach concerns with that as well. We don't know the purpose of the individual who's seeking to access Dane Ramoon's medical notes.
Yeah.
And let's say they do get that information, and they go and spread all of your medical history with everyone.
Yeah.
We don't want that. We want your information to be safe and secured and exclusive to you and your physician.
Well said. Well said. Now, insurance is top of mind right now. And Rohan, I'm going to ask you this one. Is, a lot of people, they leaving the house if their child is sick, or they're feeling like overwhelmed. And especially because of the time that we live now. We see so many popular actors, basketball players, even kids that are dropping quickly for medical reasons, right? Some of them are no longer with us, right? And I want to ask, you're leaving the house, you're rushing out. You don't have time to a lot of times bring your insurance documents. So is this a must?
And you said it's a must. It's vital. You are coming in order for a service to be provided.
Yeah.
You have taken the safety measure to make sure that you have insurance. So for you to come in and to show the proof of your insurance, now we are aware to know specifically and exactly what type of coverage you have, possibly how much that service may cost, how much to charge based on your insurance. The information that we gather when you register, that information has to now be sent off.
Yeah.
Based on you coming in to get a service. So it's, and I'm saying it's vital because it also helps processing.
Mm-hmm.
It helps us to not have delays, with information being shared back and forth. So if you do have insurance coverage, we want to know that what benefits you have on your insurance, it is able to be used for the services that you are requesting.
Yeah.
Because what we don't want, which can be costly, is for anyone to come in and they are given a service, but they are unaware that the service was not covered.
Yeah.
Because you are not knowledgeable or aware of your insurance coverage.
Yeah.
So it's important on our end, as well as the patient having knowledge of what their plan covers.
Yeah, John, you wanted to add something to that?
Yeah, to add to that, you ask, is it a must? It's situational. And in an emergency situation like what you described, it is not a must, especially if the person coming in is unresponsive or the need for immediate care is there. We are not, as an organization, going to prioritize our payment over your care. You, as a patient, take priority. We worry about the logistics of payment after, and we take care of you. Our priority is your health and well-being and securing your life. So when you ask if it is a must, it depends on the situation. There are times where you go for a routine checkup where we expect you to provide those information, those details. However, you come in an emergency situation, then no, it is not a must. We are going to extend care to you first, and then we seek to sort out the logistics of your insurance.
That's an amazing piece of information, because I know that, a lot of times, and I'm not saying movies are everything that happens in life, but you watch a lot of movies where people are denied health care until they provide their insurance. And you hear stories like this all over the world, not just in movies that we watch these days. These are stories that we are even close to home. We've heard stories in won't mention any hospitals, but there are things that's been stated before that, I couldn't receive, no matter how bad the situation was, or that person couldn't receive medical care because they had no insurance. So this is a pretty big topic for a lot of people. And it leads me to my next question, because are you saying for everything, or is it for some cases? Because if somebody's coming in with a common cold, for instance, you then are going to perhaps delay health care until they provide their insurance, correct?
No.
Okay.
So that is
It's important to ask the question.
That is a very good question.
Yeah.
We do not deny nor delay healthcare.
Wow.
Due to a lack of proof thereof for insurance.
Mm-hmm.
There are other processes that would then come into play, where we would ask you to fill out some documentation to say you have not provided any insurance, therefore you will be responsible for the bill up until you provide that insurance, or if you don't have insurance, you are expected to pay. If you're not able to pay everything at once, we can connect you with our patient financial services counselors, who will work out a payment plan for you. But we don't turn anyone away for the sake of money. Our priority as an organization is our patients.
Yeah.
And their health.
It's good to know too, because a lot of people, because this has been mentioned in every interview, and I kind of feel there's always a new listener. HSA, they're saying all these wonderful things. And I know there's a few of you that are sitting down in the car right now saying, yeah, that's good that they're saying that, but they're only made for government employees. A lot of people don't know that HSA is for the people. It's for everyone. That is such a misconception. Everybody kind of feel like, okay, well, I can only go to HSA if I work for the government. There are truly people that feel that way, right? And they would never attend because of that. Can you guys, I know this is a little bit off of talking for insurance, but you guys are sometimes the first people to meet patients for the first time. So is this true, or is this a legitimate statement?
That is absolutely not true.
Yeah.
The doors are open to everyone.
Yeah.
To give an example, persons living in the island may be of that mindset, but we cater to people coming on vacation, international patients.
So I was about to say, a tourist may be listening right now.
Exactly. And we treat them with the same level of care and respect and integrity that we do anyone else who walks through our doors.
Yeah.
So it is absolutely a stigma that is out there, where people believe that only persons with cynical should or can come to HSA. We accept all major health insurances, and we welcome everyone through our doors.
Love that. Now, Rohan, what happens when you go in the back and you're doing that scary thing that a lot of us are trying to figure out? Okay, what are they going to say now when you have to go and verify insurance? And you guys have to step away for a second and say, hey, let me just call the insurance company. What are you guys really doing, and what are you talking about on the phone? When I'm on the computer, I see sometimes you guys go and behind the computer, you're tapping in, we're just sitting there nervous like, oh boy, here we go. Here we go. Can you let us know what's happening in the background?
All right, so again, registration, it is a process, and it's a timely process. And a part of the process is us verifying. You are providing us with an insurance card, and what you are saying to us is that I am giving you this card. I have benefits, so therefore we have to check to see what benefits are available. We have to check to see if the insurance is active. We want to try our best to also educate you so you are aware of how much benefits you have available for the service, so that we are able to educate you along the way, so you are aware, so you are not caught off guard based on the price of that specific service.
Yeah.
So it is a format of us assisting and helping, but it does take time for us to call, and we have to wait for someone to answer. And so, it's intricate and it's detailed.
Yeah.
But it's all about safety, because after that now, we have to send that information to their insurance company. So the insurance company is aware of the services we provided and what services they are used. So it's just a process of us helping. It shouldn't be scary. We know that it's time consuming, but it's a part of the process.
I think the scary part is, and I can speak to some of the listeners because I know they want to get the best results from this interview and the best information, is the fact that your insurance will say, this is your coverage, this is what you're going to get. But then it feels like it varies depending on where you go. Like, depends on which hospital you go to. It kind of varies on what is covered in certain places. I may be wrong about that, but I've heard people say different things about different medical institutions that they would go to, and they'd be like, well, I felt like my insurance should have covered that. And I think that's the scary part for people. It's like, am I covered? Do I have to pay this amount of money? And we're going to talk about copay and all that very soon, because I think the real breakdown is, here's where the problem is. I truly believe that there are listeners right now listening to this interview that don't understand how insurance works. And I think that's the part that needs to be educated. I think that's the situation, because you hear something fancy with insurance when they first come in and they read the paperwork, but it's human nature to only read the headline. It's to only read the headline. 100% coverage right after deductibles, right? You have to get this done first. And I think that's the real question. Explain, guys, because I think you'll do a good job with this area.
That is a very valid statement. A lot of people believe that once they have insurance, that is the be all end all, that their insurance, because they pay a monthly premium, that they have no responsibility as the patient to pay at the counter as well, which is not the case. A lot of private insurances, when I say private versus cynical, government employees, private insurances cover 80% of a standard doctor's visit, and the patient is responsible to pay 20%. Now, another thing that's commonly misunderstood is most of those insurance companies will only give you $400 for the year for that kind of visit, which includes lab diagnostics, physician visits, and so forth. Every time you go to the doctor, money comes out of that $400. And once that is depleted, it is then the patient's responsibility to pay 100%. And that is the most basic insurance coverage plan, which is the SHIC plan, the Standard Health Insurance Contract.
Yeah.
Persons with that SHIC plan are not properly educated on how it works. They believe that they have insurance, so they can just use their insurance to cover everything all the time. Unfortunately, it's not the case. Once that $400 is exhausted, they do not get any coverage for that particular type of visit again until January 1st the following year. It starts over. People believe that because their insurance has been exhausted, that they're being robbed, that they should no longer pay for insurance because they have no more coverage.
Yeah.
That is also another misconception. Insurance is very broad. There's different allocations for different types of treatment. There is an emergency fund that your insurance would cover if, for example, something detrimental were to happen to you. There is dental. There is vision. There's wellness for females who go and see a woman's doctor. There are different types of coverages that apply. However, the insurance doesn't bundle everything into one. They segregate them into different accounts and only pay out based on the type of service the patient have received.
Okay, that's good to know. Rohan, anything else you want to add on to that?
I just want to add, this may answer a question for different individuals. I've only used my insurance one time. How is it that I don't have any benefits?
Yeah.
Well, based on what John had just explained, if you are only getting $400, you can go get treatment And that treatment could be $700, $800, or $900. That one visit can exhaust that $400.
Yeah.
So as we are explaining, it's a whole lot of different dynamics, which I do believe individuals need to get a better understanding of their insurance and ask questions.
Yeah.
Yeah. I mean, we try our best to explain whenever someone seems a little frustrated. We try our best to explain as much as we are able to at that moment in time. But the most important thing is for individuals who are coming in who do have insurance is to make sure that they are that they understand completely what their policy covers and what it does not, how it works.
Yeah.
So when we are now providing information to you, it would be information that you already are aware of, or if you're not fully aware of it, then you can say, you know what, I've heard that before, and you have now connected the dots. So we are there to help, we are there to assist, and we are there to guide. And we try to do so as best as we can, as much as we can. But again, I'm going back, it's a relationship.
It is.
It takes both of us to collaborate and, and to be able to have dialogue so that when you come in, you don't feel as if that you are not getting the service that you came in order to get. So
Absolutely.
We just want to be able to provide some clarity on that.
I love that. Thank you, Rohan. John, now we're going to touch on copay because I think we did talk about that, but that's the 20% that you were talking about with copay. You want to explain that a little bit more for customers that are listening right now or future patients?
So it's 20% of the bill for the day that for the service that you received.
And we usually hear that when we're ending our visit, depending on what you're coming for. You guys would look at the patient and say your copay amount is
correct.
Right. Okay.
Correct. Because we can then see what charges have been applied to that visit, and it's a simple calculation of what your responsibility as the patient is. Now, the copay is something that can fluctuate.
Yeah.
And I say that because you go to the doctor today, and you only see the doctor. They give you a few prescriptions, send you on your way to the pharmacy. Before you go there, you stop by. You're only going to pay the 20% of the doctor's fee.
Mm-hmm.
However, you come back again 2 days later, and the doctor deems it necessary for you to get an ultrasound. You need to get an X-ray. You need to get some blood work some blood works done. All of those tests will significantly increase your fees for the day.
Yeah.
So obviously then at that point your copay is going to be significantly higher.
Mm-hmm.
So it fluctuates. It's not because I've dealt with patients who've said to me, "Oh, I've only paid so much this time," and it's a matter of just educating them to say, "Yes, ma'am, I understand that. However, you only saw the doctor that time.
Yeah.
This time around, you've done so much more."
So that's a good way of explaining it, because that does happen a lot of times, folks. You do come back in, doctor wants to see you again. You have to go do the X-ray. It's not cheap, by the way. When you mentioned things like X-ray and getting certain ultrasounds done, it's a very expensive process, and sometimes depending on the type of insurance you have, doesn't really cover it fully, right? And that's something that's just dependent on your insurance, and it's not the fault of the hospital, and they're doing it the best that they can. Now, if there's nothing else to add on copay, let's talk about deductible. How does that work? This one is going to be very intriguing for me. How does deductible work? Let's talk about that. What is deductible? Let's talk about that first. What is that, and how does it work?
A deductible is actually a fixed amount. So, say you have insurance coverage. Now, before your insurance will actually pay out, you have a deductible you are responsible for.
Yeah.
So you may have a $500 deductible or a $300 deductible. Simply mean that amount, you have to pay that up front before your insurance will cover that 80% and you pay that 20%.
Yeah.
So a lot of times, again, individuals are not aware of their deductible. So once they pay a certain amount, the reference may be, well, I paid. Well, yes, you did, but you only paid $100 into your $500 deductible.
Yeah.
So therefore, you have $400 that you have to pay out of pocket. Once you finish, that $400 is now exhausted based on you paying out of pocket. Then now you go into that 80-20 where the insurance, that 80-20 split where the insurance now kicks in and they pay 80 and you pay 20 up until.
Yeah. Now, you know what? It's so weird when you talk about things like this more. It's so weird, man, because what we're doing right now is finding out just what these terminologies mean, these terms in insurance mean, but also at the same time, it goes to show how many patients are blaming the hospitals for what they should be talking to their insurance companies about, because you're coming in, right? And I guys, I have to hold my hands up at this because I was once that guy when I came in and, you got insurance and you work for a really good company and you're saying to yourself, like, when you put that insurance card on the table, you think that's a magic card. It can do anything in the world. You better not talk to me in a certain way, sir. Like, as soon as I give it to you, it's like, well, sir, I'll be true. No. Look at my card. That's a magic card right there. And then you keep throwing this word around. You got to meet your deductible. No, you got to meet your deductible. That's my magic card. So it's so frustrating. But as you get older, wiser, and you start to check these things and look, and you're like, oh man, I really gave these hospitals a very difficult time. So it's good to know this information for those that were a lot, I won't say ignorant, but there were a lot like me when I thought I had a magic card too, and you perhaps think the same thing. So check your insurance. Guys, they send an overwhelming amount of information. But and I know that because I do get it up to today. But I will urge you, just like you sit down and read a book or listen to an audiobook, go and check your insurance facts, everything about it. What are your benefits? What do you get? And you can even go back to the company that you work for and say, look, this probably won't work for me, because you can't tell the hospital that. But the company will try harder for you if you have conversations. Like, there's a saying I like to tell my boys, you don't get what you deserve, you get what you negotiate. So you got to go back to the table and try to figure out how you can get an insurance that works for you, right? Because it's not HSA's fault if that's going to happen. If you're not getting the right insurance, it's not the blame of the hospital. Now, what are non-covered services? Let's talk about that. That's different for me. So what's non-covered services?
Non-covered services are treatments or procedures that insurances simply do not pay for. And the patient is responsible 100% for the cost of those things. Some of the more common non-covered services are things like DNA testing, the drug tests that the taxi and bus operators come in to do, irrespective of whatever kind of insurance they have. Most of them have Cynical. There have been long-standing government employees who are retired and now running taxis or driving buses. They have to pay out of pocket because those things are not covered at all by any insurance. You come in to do an immigration medical. No insurance covers those.
Wow.
Government or otherwise. No insurance covers those. So non-covered services can be a variety of things. And those things, what we as registration and the hospital will do is to politely inform you of your responsibility, of your financial responsibility for that service, and to let you know that insurance is not applicable in that case. Yeah.
Well said. Guys, you've done a really good job. We've had a lot of things that we wanted to get through, but what I kind of want to touch on right now between two of you, John and Rohan, is coming to the end of the interview, because we have passed an hour, is I just want you guys to kind of give any final message to patients out there. Maybe something that you felt that it was very important to touch on today, and you can give a summary on it, and then also any final message you want to give.
I think you touched on something very important when you encourage people to go out there and really educate themselves on their insurances and upgrade their insurance to better meet their needs, to be able to better to cater to their specific medical conditions, and keep your information as up to date as possible. If you change anything personal, every chance you get, come to the hospital and keep us updated. It'll only better allow us to better cater to you.
Yeah. Non-negotiable in life, before we get to Rohan, the non-negotiables for me, and I don't know if that happened with age, but I think it should be for anyone that's listening to this interview, is insurance and life insurance. Those are non-negotiable for me. Like what Rohan said earlier, is you're paying for something just in case. Nobody wants to go to the hospital and say, man, I didn't feel that 150 wasn't worth it for me. Mm-hmm. But now it is, because you're staring down the barrel of $200,000 to get an operation done, right? When that insurance could have covered you, right? That's what you're doing. Same thing for your home. Nobody wants to pay what they're paying for home insurance, but then if a storm comes, everybody wish they paid for it. So you're paying for what may take place, what may happen. And I know it sounds ridiculous saying it, but think about just how it feels. I say this, it's quite funny, and Rohan is going to understand this, and I'm pretty sure John too. But a lot of times, because of my Christianity, like, people know I'm a man of God, and they always look at me. There's always a few people that likes to challenge you, and they're like, what if he's not real? And I look back at them and I like, but what if he is? Mm-hmm. Who's in a better position if he is? Yeah. Treat insurance the same way. What position will you find yourself in when something comes about? Because this is called life for a reason. Life happens, right? So protect yourself with insurance. And please don't blame Rohan and John when you go to HSA. They had no dealings with your insurance. They're just there to make sure that you get the best care possible.
And the last thing I want to add is, just when you come to the hospital, come prepared.
Yeah.
Come prepared with your identification. Come prepared with your insurance. Come prepared to answer our questions.
Yeah.
We're not questioning you to delay your check-in process. We're just making sure that we have accurate and up-to-date information, and we are checking in the correct individual.
Love that. Thank you so much, John. Rohan, my good guy, what do you want to leave our folks with?
What I want to leave with is every detail that we are able to collect right at that moment, it's for a specific reason and a cause. Mm-hmm. And that is because we are making preparation before anything occurs. We want to put the building blocks, the foundation in place, so when the storms and the wind comes blowing, we can say that we have taken every possible initiative to make sure that you are okay. Mm-hmm. Because it's a trust factor for anyone to walk in before a registration agent. They are saying, I am here because I have a need and I trust. Yeah. So therefore, our hope is that you will trust us so we can assist you and help to take you through that process so that all of us can get to the end. Yeah. Okay, so we don't want it to be overwhelming. We want it to be a process that's applicable to the time and the restraint that we have. So, my hope is, after this, whenever someone walks into the hospital, before I even ask for an ID, and I have a lot of individual that does that, before we ask for an ID, they can say, Rohan, here's my ID.
Here you go.
This is my name. This is my date of birth. What else you want?
Yeah. Job made easy.
So, I'm hoping that we are able to work together so we can make this process, efficient and acceptable for everyone. We want to serve you with a smile.
Absolutely. I love that. Service with a smile. Guys, thank you so much for giving your time today. We really appreciate it. And once again, folks, if you have any questions for John and Rohan, you can go ahead and send it in our Instagram or Facebook handle at Bobo 103.1. That is Healthcare Today. Thank you so much for joining us.